Not a day goes by that you can't turn on the news and hear about the coronavirus. And I've gotten a lot of questions about what can kidney patients do to protect themselves and reduce the risk of exposure. Well, we're going to talk about that and more coming right up. Kidney Warriors, James here with Dadvice TV, your online kidney health coach. And this is video number 63. And today we're going to talk about a very serious topic that you are hearing all about. And a lot of you out there are a bit concerned. That's the coronavirus. Now, the best source for information about the coronavirus is going to be your local healthcare professionals as well as the CDC. For those here in the United States. For those outside the United States, find your version of the Center for Disease Control and follow them on social media and on their website. Now, let's talk about what you can do to help greatly reduce your risk of becoming infected with the coronavirus or the flu or other viruses, because the same precautions that you use to protect yourself from the flu will help protect you from the coronavirus. Now, there currently is no vaccination to prevent the coronavirus, but there are things that you can do to greatly reduce your risk of exposure. I spoke to a lot of healthcare professionals and looked at recommendations from the CDC and other organizations and put together this list of 10 things to help you greatly reduce your risk of exposure. Let's take a look at what they are. Number 1, stay home if you feel sick or have any symptoms such as fever, cough, sore throat, body aches, headaches, or chills. Seek medical advice if your symptoms are serious, if you have difficulty breathing, or if you're concerned. Most importantly, do not skip dialysis treatments if you are on dialysis. Call your doctor and the dialysis center for instructions. Number 2, cover coughs and sneezes with a tissue, then throw that thing in the trash. If you don't have a tissue, cough or sneeze into your upper sleeve. Don't cough into your hands. Number 3, avoid others who are sick. Limit face-to-face contact with others as much as possible. Keep at least 6 feet between you and anyone that's coughing or sneezing. Number 4, skip the handshake. Try an elbow bump, head nod, or a fist bump. And if you're worried of offending someone by not shaking their hand, here's a little tip. Do a little sniffle. They're not going to want to shake your hands. Number 5, wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. And if you don't have soap and water available, use hand sanitizer with 60 to 95% alcohol. Number 6, avoid touching your face as well as anyone else's. This includes your eyes, your nose, and your mouth, also known as the T-zone. Number 7, avoid touching surfaces unnecessarily. Think about using your knuckles instead of your fingertips for pushing buttons, and use paper towels and tissues for opening doors after you wash your hands. Now, this one's going to be a real challenge with children, so keep an eye on them. Number 8, routinely clean and disinfect frequently touched surfaces and objects. Number 9, stay health focused. Get plenty of rest and sleep, eat a nutritious and balanced diet, stay hydrated, and get regular exercise. Not only is this good for improving your body's immune system, but it also helps deal with anxiety. Number 10, share these tips with your family and others that you know. That way everyone's taking precautions to minimize exposure. If there is a virus outbreak in your area, you may want to reduce your risk even further by not going out unnecessarily. And if you can, work from home. It's also wise to stock up on shelf-stable foods along with water and 2 to 3 weeks worth of prescriptions. I've also updated the kidney-friendly shopping list that you can download from Dadvice TV with an emergency section. It lists what you should keep on hand to keep your kidney diet going for 6 days without leaving the house. As kidney patients, it's always good to follow these best practices to minimize the chances of getting sick. And as with any medical situation, your best source of accurate and helpful information is going to be medical professionals and the CDC. Thanks for watching, and I'll see you in the next video.